Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you.
In 1972, Matt Christopher wrote his most famous of his 140 books, The Kid Who Only Hit Homes. It was not only his best-selling title, but it also was his personal favorite and his dream to turn it into a film one day. Through the efforts of his sons, Dale and Dwayne, and producer Wayne Chesler, that dream finally happened in 2020. Oh, and that's me, Alex Montero. I played Sylvester Codman, the kid who only hit homes. During the production, I would ask Dale and Dwayne, where did it all begin? Why did the ghosts of Babe Ruth come back and teach Sylvester how to hit homes? Well, it was a secret till now, and my mom asked me to finally share it.
Hello and welcome to the Open Your Eyes podcast. I'm Dr. Kerry Gelb, the host of the documentary Open Your Eyes. If you're new here and you like our interviews, press like, subscribe, share, and hit the bell to get notifications of great new interviews. Also, please leave comments. Great news, you can now watch our full-length documentary, Open Your Eyes, on Amazon Prime, Apple TV, iTunes, Google Play, and YouTube Movies and Shows. And please share your thoughts by emailing me at drkerrygelb@gmail.com. That's drkerrygelb@gmail.com. And visit my website, drkerrygelb.com. A biomarker is a term healthcare practitioners use that may signify a disease or condition and can help plan or monitor treatment of this disease or condition. Common biomarkers include blood tests, body imaging, eye imaging, and biopsies. Today's guest, Nebraska radiologist Anna Cláudia Rosa, MD, PhD. Dr. Rosa is well-published and a contributing author to imaging textbooks. Dr. Rosa's passion is to help prevent early sickness and death using a simple, underutilized biomarker seen on MRIs called visceral fat. Dr. Rosa, welcome to the Open Your Eyes podcast with Dr. Kerry Gelb.
Thank you so much for having me here. Good morning, everyone. We are here to share information regarding visceral fat, how to detect it, how to prevent it, how to reverse it, and build a functional, independent body and an optimal life. Yes.
I really want to thank you for creating awareness of this powerful biomarker that can help people. You know, one of my passions is early diagnosis and to see who's really at risk before they even get disease, to see who's at risk and help the patient, teach them what they could do to reverse disease. Now, in the eye, we have early biomarkers such as microaneurysms. And in fact, I wrote a paper on that in 2016 with a retina specialist and a cardiologist. And you know, we're getting awareness out. So when we see these biomarkers in the eye, even before the blood tests are abnormal, many times, we could help people change their diet, change their lifestyle, so they don't wind up with insulin resistance or the path of diabetes, you know, the spectrum. And I see what you're doing by diagnosing visceral fat, something very similar and maybe even better.
So I have learned about visceral fat with my friend and doctor, my mentor, Dr. Sean O'Mara. He is a health optimizing physician and he's in Minnesota and Florida as well. And we used to work together in Minnesota, and that's when he introduced me to visceral fat. He has done a research with patients that demonstrated visceral fat on MRI and also fat in the muscles, the myosteatosis. And he was able to show that by reversing visceral fat due to simple strategies and sprinting as well, due to reversing visceral fat, the inflammation in the body would decrease and all the things that they were evaluating together were improving. So he explained to me, he showed me the results, he showed me the research, and that's when I got interested in, together with him, start working in bringing awakening and awareness towards visceral fat, because visceral fat is, if you Google or you go to Chat GPT and you Google whatever you are feeling, together with visceral fat, you're going to be surprised that everything that is causing pain and sickness and disturbing your health and your life has visceral fat as an important foundation, a root cause, like a root cause analysis. You feel something, you go there, Google or Chat GPT. Together with visceral fat, you're going to see how visceral fat is dangerous and detrimental to your body. And that's when I started describing it in my reports, because we do not learn that in medical school. It's not in the medical school curriculum. And I have done medical school in Brazil. I had done my radiology residency in Brazil, repeated this here in the United States. So I had 2 trainings and a one body fellowship training. And I have never heard about visceral fat before I have talked to Sean. So he brought me the awakening, the awareness, and I am really grateful to be a voice now to bring health.
And not only are you a medical doctor, but you have a PhD and you did research in pancreatic cancer.
I did.
And tell us a little bit about that research that you did.
So my PhD in Brazil was regarding comparing intraoperative ultrasound with other diagnostic imaging modalities, such as CT and MRI, in detecting small pancreatic tumors called insulinomas. And it's kind of interesting because right now I am dealing with insulin resistance and working towards reversing visceral fat, which is so connected to insulin. And at that time, I was studying pancreatic cancers called insulinomas. So showing that when you do an intraoperative ultrasound, you are able to detect the lesion way better than when you do CT or MRI. You are able to detect more than one lesions that might have been missed on the imaging studies prior to surgery, and also the vascular relations of the tumor and the biliary relations of the tumor, like leading to more safe removal of the tumor without damaging vessels and without damaging the biliary tree.
Seems like pancreatic cancer is increasing, and as we know, it's almost a death sentence in most people. Do you think by being able to diagnose if somebody has visceral fat and reversing it, we could lower the risk of people getting pancreatic cancer?
Definitely. I have seen different papers showing the correlation between visceral fat and pancreatic cancers, adenocarcinomas, which are the worst cases of pancreatic cancers. And they grow silently. That's why when you have the diagnosis, usually it's stage 4 and bad, and it's really hard to reverse, right? You cannot do a treatment. It's usually palliative treatment. So yes, visceral fat has been associated with increased incidence of pancreatic cancer. And there are studies showing that the increase in the waist-hip circumference ratio it's related to pancreatic cancers as well. And visceral fat, if you look at in your researches, visceral fat and cancer, you are going to see that visceral fat is correlated really very directly and exponentially with cancers like prostate, colorectal cancer, breast cancer, lymphoma, leukemia, kidney, thyroid. In fact, for women postmenopausal, that visceral fat increases, and that fat leads to producing aromatase and changing the estrogen in your body, the production of estrogen in your body. Visceral fat is definitely related to breast cancer and endometrial cancer. So yes, visceral fat is carcinogenic. Visceral fat secretes a molecule called fibrogen growth factor 2, and it is one of the factors that lead to transforming a normal cell to a cancerous cell.
So since we're talking so much about visceral fat, I want to go over the different types of fat, but explain what is visceral fat, and then we'll go over the different subcutaneous fats and the different type of the fat that people have.
So visceral fat is the fat we have in our abdomen, and it's the fat that surrounds the organs in our abdomen. And initially, visceral fat is a defense mechanism of our body. So visceral fat is like you are over consuming carbs, you are overeating, you are with a grade of overnutrition. So this hyperload of carbs, the body has to do something to keep what we call homeostasis, which is the equilibrium of our bodies, right? So when you are overloading yourself with carbs, the body grabs the carbs and the fats and starts storing it. And the way it stores it, it's by increasing the number of your fat cells, your adipocytes. To increase the size, the first step is increasing the size, which is called hypertrophy. So it increases the size until it can't increase anymore. And that's when the fat cell is usually like 100 or 200 times bigger than the normal volume. And when it gets to this limit, then it starts producing new fat cells. When it starts producing new fat cells, or even when it's increasing in size, it breaks the equilibrium, so it breaks the homeostasis and starts generating inflammation. Because the fat cell has immune cells together with it, like every other cell in our body, to protect us, right? But when the fat cells are dysregulated, are malfunctioning, what happens is that it will increase and ignite a cascade of inflammation in our body because of the activation of these immune cells. And that's when visceral fat produces chronic inflammation in our body, and we are exposed to this chronic inflammation continuously, and it's producing factors like interleucin 1, interleucin 6, macrophages, monocytes, neutrophils, fibroblasts, and tumor necrosis factor alpha. All these are like increasing exponentially in your body because of the presence of visceral fat, and one feeds the other. Visceral fat releases that, and this inflammation increases visceral fat and releases inflammation, and it's a vicious cycle in your body. And recently, there was a study proving that visceral fat also releases cortisol. The fat cells from the visceral fat also releases cortisol, which is really bad because it's the stress hormone. So it's one feeding the other in a snowball effect. And that inflammation is the inflammation that is going to bring damaging to our bodies from head to toe. Like visceral fat is bad for cardiovascular disease, such as cardiac attacks and microvascular disease and angina and heart failure, atrial fibrillation. Like we are seeing lots of cases of atrial fibrillation nowadays. And there are studies showing that by reversing visceral fat, you can improve or even resolve your atrial fibrillation because it's the fat surrounding your heart and the fat like in your heart itself as well. And also like small vessel ischemic disease in your brain and strokes and the diabetes type 2, the pre-diabetes, the fat in your liver, the fat in your pancreas, dementia, Alzheimer, which is now called diabetes mellitus type 3. So visceral fat attacks all the arteries in your bodies, the arteries that go to your brain, the arteries in your neck, the arteries in your chest, the arteries that go to your kidneys, the arteries that goes to your eyes like you see so well, and hypertension, the arteries that go to your legs, like giving you, the person is not, which is peripheral arterial disease. So you cannot walk 2 blocks or a block that you have to stop because you have this unbearable pain. And it's because your vessels are so filled with calcium that the lumen is so narrow that it doesn't provide vascularity for your legs and for your body. You could have ischemia in your bowels and everything like that.
So as the visceral fat is getting more and more inside the body, I've heard you say that it's suffocating the organs. So we have this bad fat in our body from our diet and bad lifestyle and stress, and we're going to talk about the causes more in depth, and you mentioned some of them. But we have this inflammation throughout the body, and it goes from head to toe, this inflammation. And explain about how it suffocates the organs. And is it making the organs smaller? And what is happening to our organs as this fat is surrounding the organs and causing inflammation, which is a core component to chronic disease?
So I use the term suffocating the organs, not because it's really making the organs smaller. In fact, it's not. But I use the term suffocating the organs because when you look at an MRI, and we are going to show some images here, it's really what hits you, like engages your visual, engages your senses, and gives you motivation because you see this huge amount of fat. Like I see a severe amount of visceral fat in 95% of the exams that I read daily, and I like CTs, MRIs, and ultrasounds. So you see this huge amount of fat surrounding your organs, like an ocean of fat that the organs are like floating there. And when I say suffocating, it's because it's such a huge amount of inflammation that visceral fat is chronically releasing on us in our bodies that it's damaging all our organs. It's like you cannot have a healthy organ. You cannot have like a healthy cell function. So it's suffocating because it's overloading you with inflammatory products. It's overloading the organs with inflammation instead of allowing them to be healthy and for an optimal life. And that's when I say too that visceral fat is suffocating our organs and it's suffocating our lives because it's like we are sleeping with the enemy, right? The visceral fat is inside of us, killing us slowly but surely. And we just believe that it's normal because it's the normal. 95% of the people have visceral fat. So you look around and you feel like, oh, I'm aging, so it's normal to have this belly. Oh, I have the dead body or something, and that's not normal. That's not healthy. Like you said in your documentary, we got used to believe that not being sick is being healthy. And not being sick is far away from being healthy, right?
So if we look at other countries, where people don't eat like Americans, do they have the type of visceral fat that we have?
So when I have read papers and researches from other countries that eat the natural food that we are supposed, the normal healthy food that we are supposed to eat to nourish the bodies. No, when they do not have this huge amount of visceral fat because of healthy patterns of eating, healthy patterns of moving the bodies, our bodies know better, right? Our bodies, if we give our bodies what they need, nothing else, nothing less, our bodies heal themselves. So when you are healthy, by nourishing your body with proper water, clean water, proper food, and proper movement, you keep yourself healthy for an optimal life. And that's when what you saw in your documentary in Costa Rica. These people are skinny, and they are really skinny inside and out. Hence, they don't even have problems in their eyes, and they are like 100 years old because their bodies learned, and before they were born, how to heal and how to build life, right? Daily.
So, I mean, it's such a powerful statement. 95% of the people that you see, as you're a radiologist, you're doing all these scans, you're doing thousands and thousands of people that you're scanning in the abdomen and maybe the legs and the heart or whatever, and you're seeing all this visceral fat. But meanwhile, in other countries that don't eat like us and don't have the lifestyle that we have, the sedentary lifestyle, eating the processed foods like we do, that people where they walk more, they're not having the visceral fat. I think, listening to this podcast, you have to really sit and think, of 95% of us have this, we have to change what we're going to do so we don't have this, so we don't get chronic disease and we don't die sooner from whether it's, liver disease or liver cancer or diabetes or, whatever cancer, stroke or some chronic disease. It's one thing that's interesting also with visceral fat, and we're going to go over the other fats and we're going to show images because Dr. Rosa is great at teaching you at home how to look at it for yourself, because if you don't advocate for yourself, a lot of times nobody else is going to advocate for you. I want to talk about sarcopenia, because as the visceral fat gets more, our muscles start to waste as we get older. And if you could talk about that and the marbleization within the muscles that we're going to be seeing in a little bit when we look at these images.
So again, just getting wrapping up our last thought, we just have to remind ourselves that unfortunately, obesity has been a pandemic. So yes, it's really bad here in the United States, but unfortunately, it's bad worldwide. And that's why we need to really be our advocates, because we have to advocate for ourselves. We have to advocate for health to our loved ones, our neighbors, our community, everybody we know, even our enemies, because it's a world problem for health and for life, right? But now moving to the sarcopenia. So when you are building fat in your body with the visceral fat, so the visceral fat releases glycerol for the liver gets fatty liver, and then increases glucose in your blood sugar, increases glucose intolerance, releases more insulin, the body becomes insulin resistant. So that alters the metabolism of fat and glucose in your whole body. And muscles use glucose as energy, right? And when you are getting more visceral fat, chances are that you are also getting more sedentary. So if you don't use it, you lose it. So your muscles start to become replaced by fat, which is the fatty replacement of the muscles. And that's something that Sean O'Mara was also showing that for me. And I was horrified when I was seeing that. And your muscles get replaced by fat. The same mechanism, like when you have a fracture and you have to put a cast and you don't use that leg or that arm for a while, then you get weak. You get weak because the immobilization led to fatty replacement of some of your muscle, right? So you have to start moving again and to build muscle again. So what happens with the accumulation of visceral fat and the sedentary pattern of life and the huge amount of carbs is that everything comes together and makes your muscle replaced by fat, which is the myosteatosis. And with myosteatosis, the progression is that you're going to be wasting your muscles to a point that you are going to have sarcopenia, which is the replacement of the muscles and the muscle weakness. And that's not what you want while you are aging, because you want to be independent. Like I see so much muscle replacement and myosteatosis in the erector spinal muscle that is the muscle that holds your lumbar spine and your thoracic spine. And that's what Sean shows so well. It's why we get age and we start being like that. Not because, we are also fracturing our bones because of osteoporosis and osteopenia and bone demineralization, but we are losing our muscles. We are losing the muscles that are supposed to keep us erect, right? And that's inflammation. That's also inflammation. And the fat in your muscle is as detrimental as the visceral fat and the deep subcutaneous fat. All of them release cytokines and adipokines, which are the inflammatory molecules that trigger the cascade of inflammation that I just talked a little bit before.
And what does it do to the bones?
So the bones, so if you don't have muscles, you are really not creating the microtraumas that allow to keep building more bone, because the bone keeps building together with the microtraumas. And since you are sedentary, again, you are not using, you are losing. And the food and the metabolism of calcium and metabolism of vitamin D you end up losing your bone. And for women, the loss of estrogen, you end up losing your bone and you develop bone demineralization, osteopenia, osteoporosis, increases your chances of fractures. And fractures in elderly people are like one of the major causes of morbidity and increased morbidity and increased mortality. Yeah.
Yeah, because hip fractures, if somebody gets a hip fracture, if they don't repair it, I think like 70% are dead within a year. And
Yes.
they do repair it, even 20% are dead. And only about 50% are walking in 6 months.
Yes.
So by decreasing visceral fat and not having visceral fat, we decrease our risk of hip fractures and bone fractures. Is that correct?
It is absolutely correct. And one other thing that it's really bad that comes together with immobilization and fractures and loss of muscle and loss of bones is that we have now lots of research proving that muscle is brain, right? So when you are losing your muscles, you are also decreasing your cognition, decreasing your clarity, having more brain fog, and increasing your chances of developing Alzheimer and dementia. So yes. And also, like, grab the visceral fat again. Visceral fat produces inflammation and decreases the vascularization in your brain due to small vessel ischemic disease and inflammation, and that's a major cause of brain atrophy and deposits of amyloid and tau proteins, which is the foundation, the basis of developing Alzheimer, which is now called diabetes mellitus type 3. So visceral fat is the most horrible, detrimental, dangerous thing, a silent killer, your enemy, and it's inside of 95% of us or more. And we don't learn about visceral fat in medical school. You have to research, you have to be your own advocate. You have to find doctors who are going to listen to you and walk this journey with you, supporting you in reversing visceral fat. And you definitely have to understand that it's not about, I am all for longevity, but I also believe that we have the number of years that God planned for us. But I am all for longevity, quantity of life. But mainly, by reversing visceral fat, you're going to increase the years you live, of course. We hope so. But mainly, you're going to increase the quality of your life. Because what's the point of being 80, 85, 90 years if you are with fecal incontinence, urinary incontinence, cannot see, have kidney issues because of diabetes, has neuropathy because of diabetes, peripheral arterial disease, cannot walk a block, needs a wheelchair. Why would you want that? You want to support your basic needs, which is safety and joy and fun and being honored and being valued and being seen and being heard. And who is the best person to do this? You, because you are your accountability partner. You were born with you. You are going to live with you. You're going to die with you. So walk the journey of building an optimal body, functional, independent, and an optimal life by saying yes now.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
I think it's so interesting you bring up Sean O'Mara, Dr. Sean O'Mara, who was actually started off as a cop and now is a physician. But if he's 60 years old and you look at his body compared to other 60 years old, he realized at some point that the way he was eating was wrong. And he discovered the paleo diet and he discovered eating more, staying away from unprocessed foods. And now he has a body of like a 30-year-old compared to a 60-year-old.
Exactly. So Sean is my role model. I am so grateful that he was brought to my life, and I am so grateful from learning the strategies. And unfortunately, I had my first MRI in 2021, and that's why I'm saying you really need a deep why to connect to the need for you to change your life. I met Sean in 2021. I had an MRI by then, and I'm going to show it here. that I had severe visceral fat. My quality of life was horrible. I was dealing with rosacea. I was dealing with sleep apnea. I was dealing with asthma, eosinophilic esophagitis, all this kind of stuff. And I did not start the strategies, and I did not start changing my life, making choices and decisions that would shape a new destiny, right? And unfortunately, then I started going through a huge amount of stress in my personal and professional life. And so I moved here to Nebraska, and I met Sean again by 2023. And for the last 9 months, I started following the strategies, and I'm going to show you my new MRI. I started following the strategies that he teaches so well. I started being one of his patients, an alpha person, and I am so grateful because I already had so much improvement in my quality of life, in the movement of my body, in my peak level of energy. You know, it's completely different. It's a completely different life. And that's what I'm saying. Connect to what is important to you. I connected to the fact that my grandma had diabetes, and I do not want to develop all the complications she had. I connected to the fact that my dad died being a surgeon and a super sharp brain. He died at 80, very frail, very sarcopenic, not even being able to stand up from the bed. And definitely, I told myself, that's not what I want. That's not what I deserve. That's not what I am meant for. My body is my real asset, like Sean says, my major asset. My health is an investment, not an expense. And it's an investment of time and money and energy and commitment and dedication and consistency. And I have to tell myself, choose your heart. And my heart is getting older without being independent. So I do not want to get older without being independent. I do not want to get older and not know who I am and don't even remember my name. And it's all related to visceral fat, glucose intolerance, and insulin resistance.
I mean, that's a great motivation, stories about your dad, about your grandmother. I wanted to ask you about labs and visceral fat and how they correlate.
So visceral fat, the main exam that I would say is you want to have an MRI. You want to have an MRI because that's the way you're going to see your visceral fat in your body. And you're going to know, the MRI will tell you the quantity and the quality because it's going to tell you, and it will characterize anatomically what kinds of fat you have in your body, how much visceral fat, how much fat in your liver, how much of subcutaneous fat, how much of superficial or deep subcutaneous fat, and the fat in your muscles. So the MRI is the gold standard, right? However, since visceral fat produces inflammation in your body, I followed with my own lab values. So I had my glucose fasting, which was high because I was in the pre-diabetes stage already. I had my insulin levels, which were high as well. They were like 10, not super high, but high. And I had the triglycerides checked, not the cholesterol, the triglycerides, which are what is important because the triglycerides are the food for the visceral fat, right? The food for the visceral fat. And I had also, so the main important ones I would say would be the triglycerides, would be the glucose fasting, the insulin fasting, and you could check for yourself because it's important for your health. Vitamin D, magnesium, a comprehensive metabolic panel. But again, it's for you to see that you are improving. But the major gold standard that will tell you if you are really improving or not is the decrease in visceral fat. And you are only going to see the decrease in visceral fat by looking at your waist circumference and looking at the MRI. The waist circumference correlates with the MRI, but it's not the best one because, again, some people might have a small waist circumference and be completely filled with visceral fat, which are the TOFIs, the thin outside and fat inside. And that's why the MRI is the best one.
So let me interrupt you real quick. So you could be thin, but still have visceral fat. Those are the TOFIs. Thin outside, right.
And
fat
I see
inside.
and I see these patients a lot in the scans that I read. They look like they are thin. They even have a good musculature bulk, and they think I'm healthy. And some of them might be less healthy than an obese person. And what's the difference? An obese person that has lots of subcutaneous fat and little visceral fat, it's metabolic healthy, although it's obese. Then you have the obese person with lots of visceral fat, which is the metabolic unhealthy. Then you have the thin person with little visceral fat, and that's what you want to be. A normal amount of subcutaneous soft tissue, subcutaneous fat, and little visceral fat, metabolic, healthy. And then you have the ones that believe that they are healthy and they are just waiting for the heart attack to come. And these are the ones that might be 40, 45 years old having a heart attack and no one knows, oh my God, what happened? Well, what happened is that they had lots of inflammation in their body because they had lots of visceral fat. So they are thin outside and fat inside. And the huge amount of visceral fat that is inside of them is releasing chronic inflammation, and they are thin, they are metabolic unhealthy, although they are thin. And how do you get to know that? By doing an MRI. So then you characterize where the fat is in your body.
And we're going to cue that up in just a minute. A couple of questions before we do. I do want to ask you about C-reactive protein and correlation with visceral fat.
I'm sorry, I forgot about that. So it's a marker of inflammation. C-reactive, hypersensitive C-reactive protein is a marker of inflammation, and it's together with the insulin and the glucose fasting, it's also a marker that you could follow. Some doctors order apoprotein B, especially if you are at risk for family history of cardiovascular disease. But again, these tests are the numbers that will correlate directly and proportionately. You are decreasing visceral fat, you are improving them. You are increasing visceral fat, you are increasing them. And that's when you see the coronary artery calcium score, right? It correlates progressively and proportionately to the amount of visceral fat someone has, because it correlates with cardiovascular disease and building calcium in the arteries walls. And it's not, again, like I said, not only in the coronary arteries, it's in the brain arteries, it's in the bowel arteries, it's in the legs and the arms, is in the arteries of your whole body, peripheral arterial disease and brain and everywhere else.
And the good thing is we could reverse this, and we're going to go over strategies to do it. But just to give people a background about, before I do that, do you ever do 2-hour insulin on people?
I don't order.
I mean, on yourself, did you do 2-hour insulin or just fasting?
No, I did not. I just did the fasting, yes.
Okay, I just thought I'd ask you
Did you hear about that? You can tell me about that.
Oh, 2-hour insulin was part of our paper because, we had people whose fasting insulin wasn't that bad, but as soon as they take in sugar or eat sugar, their 2-hour insulin goes crazy. That maybe 40 up to 45 is normal, but I was seeing people 150, crazy numbers, and their blood sugars weren't high. The hemoglobin A1Cs weren't high, but their insulin was high. And as we know, high insulin is just as dangerous as high blood sugar. It just happens before, also causes strokes and heart attacks. So, and that's like when people shoot insulin, there's an increased risk of heart attacks and strokes. And a lot of bodybuilders, and we'll probably talk about bodybuilders a little later, but a lot of bodybuilders die early from shooting insulin, maybe more than shooting testosterone, but shooting insulin because they're getting the blood vessels constricting and increasing their risk of stroke. And maybe you may want to make a comment on that at all.
Well, first of all, thank you for sharing that with me. I haven't researched about that. So that's something that, since I love doing research with my own body now, it's something that I might look at that. So bodybuilders, I have seen Sean talking about this the other day, about and I read about this too, that how our subcutaneous fat, the superficial layer of our subcutaneous fat, has protective effects in our body. So the superficial, you don't want too much, of course, but the superficial layer of our subcutaneous fat releases a substance called adiponectin from adipocytes, adiponectin. And adiponectin is important because it decreases glucose, it improves utilization of glucose, it decreases insulin, it improves insulin sensitivity. So it decreases inflammation in our body, and also helps with reversing the visceral fat when you are working in decreasing visceral fat. So it protects from cardiovascular disease. So I believe that the bodybuilders are in the category that when you are a bodybuilder, you are building so much muscle that you are decreasing your superficial subcutaneous fat, and that decreases the protection from the adiponectin. And you are eating so many carbs as well because of the diet that they eat. It has a lot of protein, but it also has a lot of carbs, and the carbs are the fuel for building visceral fat. So many of them might have lots of muscle, like the tophies, but might have losing the protection from adiponectin and having the visceral fat inflammatory agent, inflammatory endocrine organ inside of them.
So we're going to go over the different types of fat. So we just talked about subcutaneous fat and the superficial subcutaneous fat, which is healthy fat because it releases adiponectin. Is there a way to increase superficial subcutaneous fat?
I have to tell you that I do not know about that.
You know, that's something I researched.
I have read about different kinds of fat, and I have not seen anything saying how to increase subcutaneous fat, because like
superficial, the good one.
Yeah, superficial subcutaneous fat. Increasing superficial subcutaneous fat would be somehow gaining weight too, because it's a deposit of fat. So I believe that you have to find your healthy you without visceral fat, or as minimal as possible, because when you are decreasing visceral fat, you are decreasing the deep subcutaneous fat. And yes, you're going to be decreasing the superficial subcutaneous fat as well, but the body knows the specific amount you need, because our body heals, right, by itself. So your body is going to keep the amount that you need for your health, and then you should not like work out too much to a point that you would be decreasing that superficial subcutaneous fat.
Okay, so we have the superficial sub-Q fat. Now we have the deep sub-Q fat, subcutaneous fat, and that is bad fat. That's inflammatory. So can you talk about that, and how is that different than visceral fat, or is it really the same, just really where it is anatomically that gives it a different name?
So where it is anatomically gives it a different name. So we have the superficial, we have the sub-Q fat, subcutaneous fat, which is the fat in between our skin, and I'm going to show that in the images, which is the fat that it's in between our skin and the abdominal wall that has muscles, and right? So that's the subcutaneous fat. So the subcutaneous fat from the skin to a fascia that is called Scarpa's fascia is the superficial layer. And the superficial layer is beneficial, and your body is going to determine the amount that you need. And it's beneficial and releases adiponectin, which protects against cardiovascular disease, which decreases inflammation, like I said before. Then in between the Scarpa's fascia until the abdominal wall musculature, you have the deep subcutaneous fat. The deep subcutaneous fat is as detrimental and as dangerous as the visceral fat, because it has the same inflammatory properties. It's releasing inflammation, chronic inflammation, to activating your immune system cascade all the time, 24/7. And then you have the fat that is within your abdominal cavity, below the musculature wall. That's the visceral fat. And then you have the fat that is located in your liver,
ectopic fat?
Fatty liver. I'm sorry?
Ectopic fat.
Yes, the ectopic fat. So then the ectopic fat encompasses the fat in your liver, which is the fatty liver, which is also inflammatory and will cause damage in your liver. That's when you have non-alcoholic fatty liver disease, is the first stage, fat deposition, because of excess of glycerol in your liver. Then you have inflammation of your liver because your hepatocytes say, I can't handle this anymore, and activates the immune cascade trying to heal, and the immune cascade leads to inflammation, which is the steatohepatitis. The steatohepatitis, your liver cells say, I can't handle this anymore, and then it starts trying to form a scar tissue, and it fibroses because it activates the fibroblasts, and then you have fibrosis in your liver. Here, you are already in a bad situation because fibrosis is not reversible. So you want to reverse your liver disease before fibrosis.
And fibrosis is cirrhosis.
Fibrosis evolves to cirrhosis, and cirrhosis is the end-stage liver disease. And that's when you create a perfect storm and a perfect environment for developing liver cancer, which is the hepatocellular carcinoma. So we have the fatty liver, then we have the fat in the pancreas deposition, which is also inflammatory, and it leads like to prediabetes, diabetes, because you're losing alpha cells. You're losing cells that and beta cells and all the cells from the pancreas that are important for your glucose metabolism, the beta cells. Then you're going to have fat surrounding in your chest, surrounding your great vessels, your aorta, the vessels that goes to your neck and to your brains, and fat surrounding your heart, which causes the atrial fibrillation, cardiac insufficiency, cardiac failure. And you're going to have the fat surrounding all the organs in your chest, the mediastinal fat, and this is also ectopic fat. And all of them are inflammatory, okay? All these ectopic fats are inflammatory the same way as visceral fat. And the last one would be the fat in your muscles, which is also inflammatory. So the only fat that is not inflammatory is the superficial layer of the subcutaneous fat. All the other fats that I described right now, they are inflammatory driven and inflammatory producing inflammation.
How about brown fat? Supposedly brown fat is good.
Yes. So brown fat is the fat that usually newborns have a lot of brown fat, and it's located in their deep neck. For us, the brown fat decreases with age, but it's still located in between your scapula, which is the shoulder blades, and it's also located in your abdomen surrounding your kidneys. Brown fat is good. Why? Because brown fat has lots of mitochondria and so while white fat, so we have white fat, it's the fat from the visceral fat and the fat in your muscles. That's white fat. White fat is bad because it produces inflammation, it increases glucose, it decreases insulin, it increases insulin, and it decreases insulin sensitivity. That's white fat. Brown fat is the fat that is protective. Brown fat is the fat that is thermogenesis, regulates our temperature when we are exposed to cold, has mitochondria, and burns energy. So brown fat does the opposite. Brown fats burn glucose, brown fats decreases insulin, and brown fat improves insulin sensitivity. But we do not have lots of brown fat because in our society, we are overloading with carbs, right? So what is important to do is strategies that will increase your brown fat, which is cold exposure, stress hormesis, and the other strategies that are decreasing visceral fat, because when you start decreasing visceral fat, you decrease inflammation in your body and your body starts healing itself. And also, you could have a third category of fat that has been described recently called bright, B as in brother, R-I-T-E, which is the whitening of the browning of the white fat. So browning of the white fat. So when you do these strategies to heal from your visceral fat, you are trying to transform, you are working on transforming some of your white fat in brown fat. And that happens. And this new brown fat that you are producing in your body has lots of mitochondria, also is going to expand energy, also is going to improve your glucose tolerance and decrease your insulin resistance. It doesn't have the same thermogenesis quality from the real brown fat, but it has the energy expenditure quality from the real brown fat.
So
that's why we are talking so much nowadays about cold plunges, cold cryotherapy, because it definitely decreases inflammation and allows you to work on increasing your brown fat in your body.
and it burns calories without just, that's what you mean by thermogenesis.
Yes.
You're just burning calories by sitting. The brown fat burns calories. And apparently dried fruit, apples, things with uric acid could help build brown fat.
I do not know about that because I try to avoid the carbs that have high glycemic index, and fruits are really the high glycemic index level, especially apples. The fruits that have low glycemic index are more like the berries. But I am a person who I had to understand that I love fruits. So for me, not to ruin the efforts I'm taking, I try to avoid fruits, and unless they are fermented veggies and fermented fruits, because then you take away the carbs and you take away the damaging effect in your gut microbiome.
And
Because now we know that the gut microbiome is the real king of our bodies, right? They rule the brain, in fact.
And before we're going to pull up the slides now, but before we do, just the last thing, let's just summarize the causes of what causes bad fat, visceral fat. So if you could go into some of the causes of what causes it, so people, kind of give them a list of things.
So what
the best of your memory.
Yeah. What causes visceral fat is the overload of carbs, right? Our bodies do not need carbs. It's a lie that has been told us over and over and over again, so many times, right? Our bodies need fat, and our bodies need protein, mainly protein. Our bodies do not need carbs, and so an overload of carbs really is the main culprit that leads to excessive visceral fat, because the carbs are going to be transformed in glucose by the liver. The fats are going to overload the liver, and is going to overload the lipocytes or adipocytes, and then again hypertrophy, hyperplasia, inflammation, hypoxia, angiogenesis, hypoxia, deaf cell, more inflammation, more inflammation, more inflammation, and it's a trigger of inflammation 24/7 in your body. Bad fats are very toxic for your body, like seed oils, canola oil, vegetable oil. You want to eat fats that are as natural, like you don't want margarine, you want butter, you want lard. That's what you want. You want food that has less chemicals, less preservatives, less toxins. So you want grass-fed, grass-finished beef. You want pasture-raised eggs. You want raw milk. You want fermented veggies, fermented fruits, because then you take away the carbs from them by the process of using the process of fermentation. And everything that is processed food, stay away from processed foods. Processed foods is a poison. So when you go to the grocery store, and I did my experiments since people tell me all the time, you don't have to walk in the middle portion of the grocery store unless you need to buy toilet paper. And that's fine for me. But you walk just in the periphery of the grocery store, and you're going to get your eggs, you're going to get kefir, you're going to get your fermented, you're going to get good quality meat, butter, and fermented cheeses, and that's what you want. And if you like fruits and vegetables, although they come with a lot of pesticides nowadays, but try to get the organic versions, and that's what you should work towards for nourishing food. You want food to nourish your body and your soul. And water. Be aware that the water we drink nowadays, it's very, very contaminated. It's not like living water, like the water that our ancestors drank from, like natural water streams. So it doesn't have many minerals anymore. And it has lots of chlorine. You don't want chlorine. Definitely, you don't want chlorine. And you don't want chlorine in your showers. You don't want chlorine in your bathtub. You don't want chlorine by drinking water, because chlorine damages and destroys the health microbiome in your gut. And then you end up with leaky gut, which is another form of increasing inflammation and feeding visceral fat. And again, we have all these vicious cycles happening in our body, and we just have to make them become virtuous for life. Yeah.
I have to ask you, sugar and alcohol. Sugar and alcohol,
yes. I put them in the processed foods, and since I don't eat them, I forgot I don't drink as well. So sugar and alcohol. And Andrew Huberman, which is from the Huberman Lab podcast, he has, for people who like drinking, he has one episode just about drinking. And if you do like drinking, you definitely should go there and listen, because it's eye-opening, and you're going to understand how much alcohol is damaging to your brain and leads to brain atrophy and loss of cognition and so many bad things in your body. Yeah.
Stress.
Not only your liver.
How about stress increasing visceral fat?
Stress is horrible. Many people, and including me, I am really fighting against visceral fat, and my visceral fat is decreasing, but in a very slow speed, because I do have lots of stress in my life. And yes, stress is an enemy that, again, such as like visceral fat, we don't see, we sometimes minimize, but it's definitely cortisol feeds visceral fat and feeds glucose intolerance and feeds hyperinsulinemia. And then visceral fat, adipocytes, fat cells produce cortisol, and we just keep this snowball effect. But there are strategies that are very good for decreasing stress. Like Sean says, you cannot fight the lion, you run from the lion, right? So stress techniques strategies to decrease stress. You can do sprinting. You can do high intensity exercises until you fail. Cold therapies, sauna. So yes, sunshine, sunset, sunrise, and staying out in the sun, walking after your meal. You eat and you walk for 10 to 15 minutes. You improve the utilization of glucose from your muscles. You decrease your blood level of sugar, and you improve your insulin use as well, your insulin sensitivity. So I would say, if you are not used to walking, I wasn't as well, and I was really lazy about walking, but I started after I saw my dad not being able to walk. And if you aim for 5,000 steps, you're going to get this super fast, because if you're doing nothing, chances are you're going to be around 2,500. So and it's like 1,000 steps for each 10 minutes. So you only have to walk 20 minutes, eat and walk. You're burning glucose and you are getting your steps. And when you get to 5,000, slowly increase to 10,000, and you're going to see that it's going to make a huge difference for your brain, for your energy. And you could use the time to listen to a podcast, to walk in the nature, to walk barefoot, improve your grounding, to have sunshine, or to just connect to a friend, make a phone call, connection. It's everything about body, but we have to remember that it's mind, body, and spirit. So connection and with friends, because we are social humans, connection, and joy and gratitude, all these like heals together. We heal together. It's like a wheel from a car. You don't want to improve just the physical side. You have to improve your spiritual and your mental side and mood together. Otherwise, it's not going to be a circle. It's going to be a triangle, and then your car is not gonna drive as well, right? You're going to be bumping. You don't want to be bumping. You want to flow smoothly.
How about lack of sleep?
Again, horrible. Lack of sleep is horrible also, because lack of sleep increases insulin, increases cortisol, and decreases growth hormone. So lack of sleep, you have to aim to sleep at least 7 hours a night. So you have to really have a sleep routine that you're going to turn off from your social media, turn off from your phone, turn off from blue lights, use the glasses that protect from blue light, have like dimming your lights in your house. You can use candles, decrease exposure to TVs, and again, like I said, computers and phones. Maybe have a warm shower before you go to sleep because it relaxes you. Maybe do a blanket that is heavy and also cool temperatures in your bedroom. You could also use a grounding blanket that is gonna like release the bad energy, release the energy through the grounding blanket while you sleep. I don't like noises when I'm sleeping, but you could use like the calm apps, mindful apps with meditations. Practice gratitude before you go to bed, releasing the things that you can solve because they are already solved since they can't be solved, and just leaving the things that need to be solved for the day tomorrow. And yes, so sleep is really important. Oh, and to regulate your circadian rhythm. The circadian rhythm is the rhythm that regulates your sleep, right? It's awesome the sun. Using the sun, it's free. It's for you, right? Go outside, see the sunrise and see the sunset. At least for 3 minutes, take your glasses off. Do not have any barriers. Do not look at the sun when it's going to hurt your eye. You have to look at the sun. Dr. Gelb knows it so well. You have to look at the sun when it's around 45 degrees and it's not going to hurt your eye or burn your retina. You don't want to burn your retina.
No,
I'm not responsible for that.
We don't want people looking at the sun. Let me ask you about this vegan diets. And then we're going to cue up the slides. I know people are waiting to see the slides, but I wanted to give them a good background, and you're doing a beautiful job teaching people. Vegan diets, what do you think?
Oh, man. I don't want to be against anyone. I'm very, you are responsible for the choices you make. Remember that your choices and your decisions.
Let's put it this way. How about vegan diet for you?
Vegan diet for me, not for me. Vegan
Why?
diet is definitely not for me. First of all, I'm Brazilian, so I love meat, right? I would not deal well with a vegan diet because I do love meat. So, and also because veggies and fruits nowadays have like I said, have so many toxins and poisons in it that it definitely leads to visceral fat and inflammation. Also because of the glycemic index, I am a person predisposed to prediabetes and diabetes because of my family history and visceral fat production. So, and I have seen like my friends who are Indian and eat lots of vegan food, or patients and clients from Shan, or even the scans I read every day. The vegan people are people who have less muscle, are people who have more visceral fat, and I don't believe from what I see that it's healthy. I don't.
I mean, I see a ton of people,
inflammation production.
ton of vegans, people from India that are vegans, and they're have terrible cardiovascular disease.
Yes.
And they have very bad diabetes, a lot of them, because they kind of run out of things to eat. They're eating sugar and carbs all day. It's not like they're just eating healthy vegetables all day.
Yes, and some of the veggies and fruits have a huge amount of carbs, right? And the carbs are the fuel for visceral fat and liver disease.
Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Fitting multifocal contact lenses presents a big opportunity to meet patient needs while growing your practice. Alcon is your partner not only with our innovative portfolio, but through e-learning. Learn to enhance your multifocal strategy today with the Alcon Experience Academy.
OIE Broadcasting is the emerging leader in social media. We use scientific entertainment to drive more patients into your office.
Visit oybroadcasting.com and sign up today.